Polycystic kidney disease, also known as PKD, is one of the most common inherited diseases affecting 1 in 400 people. It has similar prevalence rates amongst all ethnic groups. It's a progressive disease affecting multiple organs, including the kidney, liver, spleen, pancreas, and even the thyroid gland. The hallmark of PKD is gradual and massive enlargements of the kidney, ultimately resulting in kidney failure. In fact, it's responsible for 5% of patients on dialysis. So you might recognize this picture of a karyotype, a picture of one's chromosome. We have 23 chromosomes. Chromosome number 23 is a sex chromosome, and this determines the gender of a child. The remaining 22 are called autosomes. The chromosomes of a child are inherited from our parents. One from each pair comes from mom, and the other comes from dad. So let's talk about autosomal dominant and recessive. What's the difference between the two? In the case of a disease that's autosomal dominant, we need to inherit one defective gene to get the disease, only one. In the case of autosomal recessive, we need to inherit 2 defective genes in order to get the disease. And there's 2 types of autosomal dominant PKD, PKD1 and 2. PKD1 is located on chromosome 16 and PKD2 is located on chromosome 4. Now, in PKD1, it's much more severe. The onset occurs much earlier in life, and the average age to start dialysis is about 53 years. PKD2 is less severe. The onset occurs later in life, and the average age to start dialysis is about 69 years. The genetic disease leads to a defect in a protein called polycystin. This protein is responsible for blocking cells from growing in size. So if we have a defective polycystin, what happens is our cells begin to grow in size rapidly, forming cysts. As time progresses, your kidneys can be filled with dozens of cysts. These cysts can become filled with fluid, causing your kidneys to be large enough, and it can even be the size of a football.